Together with Maarten Uiterborgaert and Robin Lemmens, two other stroke neurologists, we obtained funding for a novel study regarding carotid artery disease, because during the thrombectomy, in a lot of patients, the carotid stenosis is already shown. And maybe you can treat it immediately in those patients with a stent. Opposite to doing carotid surgery in the patients that recover well enough to undergo surgery. And actually, we do not know if that is a good thing. You might think, well, you are doing the procedure anyway. Why not placing a stent? But the problem is that you introduce a higher risk. You have to start double anti-platelets immediately. So you may cause more brain bleedings. And also placing the stent is not without risk, as we know from ICSS, for example. So when you look at the literature and the cohort study that has been done, there is complete equipoise. It looks the same. And also there's a lot of practice variation. Some people say you need to do it. We do it all the time. We never have complications. Others say don't do it. It's harmful. We do see complications. Wait. And that's always a good thing for a trial. If there's so much practice variation, then you know, okay, we don't know. So what we will do is we obtained funding for a large new trial in the Netherlands and in Belgium, and we will compare two strategies. So it's not a direct comparison, but it's comparing stenting a carotid stenosis during EVT, if there is one. And we compare with the group where we don't do that. So you randomize, do it or not when you see a carotid stenosis, actually a tendon lesion. But you compare it with the clinical outcomes of the group where you do not do it immediately and where part of the patients will undergo surgery later on. Not all of them, because not all of them will recover well enough. So it's really comparing two strategies. And it's designed as a non-inferiority trial, because we think if it is non-inferiority, it's good enough, then it will first be highly cost effective because you don't have to do new admissions and operations. And second, it will be very pleasant for the patients because they don't have to go into the hospital again for an operation. And it's called the CASES study, and we look very much forward to start it. And it will very soon be started, and the first patient will be enrolled, hopefully.